The University of Tennessee Health Science Center College of Dentistry is dedicated to providing professional, graduate, and postgraduate education, conducting dental research, and delivering state-of-the-art dental care all under one roof.
From an academic standpoint, our job first and foremost will always be you, the patient.
We have it in a very caring, considering, empathic environment where we provide patients with pain-free dentistry, and we allow patients to be able to keep their teeth for as long as they're able. That's our goal.
At the College of Dentistry and our pediatric clinics, our job is taking care of children.
We see younger kids or kids that have a high anxiety or fear level, so we try to make it as friendly as possible.
We have the time to spend with the patient and to spend with the parents, to really educate them, to help teach them. How do you take care of your children's teeth?
We've been able to expand the 3D imaging in dentistry in almost all the disciplines of dentistry.
We have all departments and disciplines under one roof and one umbrella.
The exciting thing about being in an educational facility is we have the ability to bring in residents from other programs that are going to see these patients in their practice.
They're offered multiple treatment plans that will enable them to make an affordable treatment option.
We're trying to make sure that everyone gets a chance to have every opportunity to seek dental treatment.
I firmly believe that we're providing a tremendous service to the community. Our residents and students and faculty are really committed. We really want to be a partner in helping the community, in helping patients, and enable them to keep their smile.
Hello, I'm Dr. James Reagan, and I'm the Dean of the UTHSC College of Dentistry. I'm a proud graduate of our dental school, and I want you to know that our school has had a reputation of excellence in dentistry. This film will describe what you can expect if you become a patient at our dental clinic. I sincerely hope that you do choose to become a patient at our clinic and become part of our dental family.
The Office of Clinical Affairs ensures that the highest level of patient care and student ethics are practiced for every patient encounter. The College of Dentistry is proud to have embraced the latest and greatest technology offered in dentistry to bring you the most optimal level of dental care available. We are proud to offer our patients three-dimensional imaging technology along with many other high technological advances in dental care that ultimately provide the most advanced diagnostic capabilities to our students and faculty. We have updated all clinical areas with the highest quality dental chairs and delivery systems for our students and faculty that supports patient weights up to 350 pounds. The Office of Clinical Affairs welcomes feedback from our patients, and we are always available to our very valuable patient family to provide support and resolve any issues that may arise during your treatment experience.
We want to go over a few things with you this afternoon to explain exactly how we do things here. There are things we would expect from you, and there are in turn things we're going to do for you. And I want to make it all clear so you all understand. First of all, this is a teaching institution. We are teaching dental students to be dentists, and we need patients. So where do we get our patients? We get them from you. You're very, very important to us. In the medical school across the street, they have patients in the hospitals. The students follow the doctors around, and they have ready-made patients. We don't have that here. So we are looking for patients, so you are extremely important to us. And we thank you for being here, and I want you to know you're going to get great dental care, the best possible, and we're going to do it as quickly as possible, but we're going to do it as well as it can be done. I was a student here 40 years ago, graduated from here in '81. I have restorations done here 40 years ago that are still functioning. Now, I'm not promising you that everything we do here is going to last 40 years, but I promise you it will be done well. Now, we're a teaching institution. What does that mean to you? First of all, you're going to come here and you're going to receive great dental care at a lower fee than you would get outside in Memphis or in private practice. Now, we run about a third to a half of what the normal fee for dentistry would be. On average, I've found that about 30–35% is where we land. If something costs $100 out in Memphis, it's going to run you $30 or $35 here. Now, that's not across the board, please. but that's an average. Now, what are you going to give up to be a patient here? Well, if you've got time, we will do great dentistry for you. We are slower here than the private practice world because the students, they're third and fourth year students, they're juniors and seniors. They have 2 years of preparation to get ready to hit the clinics. When they hit the clinics, they're ready. So we have a group of juniors and a group of seniors, and everything they do has to be checked and rechecked by faculty. We have excellent faculty here. Most of us have 30 or 35, 40 years of experience in private practice, and we'll talk about that in a moment. So the student is not terribly fast. We don't care about that. We want the student to be accurate and good and do beautiful dental work. Now, let's say we start a procedure and the student has to get a starting check. I'm going to come over, or another faculty, and we'll examine your tooth and decide the treatment, and then we'll start. Then the student will do step 1, he'll call us back over, we'll check that. And then step 2, step 3. So we are slower here, much slower, but we are excellent in our care. Now let's talk about your dental appointments. We have morning appointments and we have afternoon appointments. Morning appointments start at 9 o'clock, they end at noon. Afternoon start at 1, end at 5. Now we like to get out a little bit earlier, so maybe quarter till 12, quarter till 5. But the student has to do the work in that time. And not all of your visits will be that full time, but be prepared when you come here that you may stay 2 to 3 hours or 3 to 4 hours. And there's a lot of downtime where we're talking and checking, and if something is questionable, we'll call another faculty member down from another department. He'll go over everything with us. So we want to make sure your work is done properly. But what you'll give up is your time. So if you've got a little time and some patience, and you want to save a lot of money, we will do great dentistry for you. If your case is too difficult, if we deem it too difficult for an undergraduate dental student, we have graduate programs here where we can refer you to endodontics, to surgery. If you need to be put to sleep, we've got a surgery department, periodontics, we have children's department here, pedo. But some folks come in here and we decide this is too difficult. We cannot do this on the undergraduate level. So we have graduate departments that will take care of you. People ask me often that come in here, is there any reason why I would not be selected to be a patient here due to some illness? Yes, there are situations that come up, but they're extreme. Diabetes, heart disease, high blood pressure, things like that, we handle all that, and we take precautions. But we can handle just about anything that comes in here. Our faculty, they're fabulous, they're experienced, they're wonderful. They've been at this a long, long time, and I think you'll be very pleased. Now let me explain about our group leader program. When the student hits a clinic, he's been here 2 years preparing, and there are about 100 students per class. And when they come over to the clinic, we have third and fourth year students, so we've got about 200 students on the floor. We've got 127 chairs up here, and they're usually full. When the students come over and they start working on you, they're broken down into 8 groups. And those 8 groups have about 24, 25 students in them, hence 200 students. Now, we've got 12 juniors, 12 seniors. There are 2 faculty members assigned to those 24, 25 students. They will oversee everything that is done. I'm one of those group leaders. So I will be there on the clinic floor. You may be in my group, but you're closely supervised. And that's very, very important because we don't turn these students loose. It's very, very, let me stress this, important that you keep your appointments. Now, when the student makes an appointment with you, he's set up 3 to 4 hours to see you. And the students request me, I said, what do you want me to say to the new patients? Say to the new patients, please do your best to keep your appointments. If you have a problem that arises, which often occurs, you may have a child sick, you may have a flat tire on the way, things do happen, we understand that. And sometimes you have to cancel an appointment at the last minute. And if you do, we try to understand that. But the rule here is if you no-show 2 times for appointments, and I mean no communication, you just don't show up, we will dismiss you as a patient here. We like for you, if you can, within 24 hours to let the student know that you can't come to the appointment. And the rule here is if you have 3 appointments broken after 24 hours notice, then we will dismiss you. Now, dismiss means that we probably would not take you back as a patient. So, this is very important. Keep in close communication with your student. You'll learn to love your student, but you'll have his cell phone number, he will call you, he will be in communication with you. If there's a problem, you can call him instantly and say, I've had a problem, my daughter's sick, my mother's sick, I'm not going to be able to make it. Now, when you become a patient here, sometimes things happen in your life where you have to stop treatment. And I'm going to explain comprehensive care in a moment, but let's just assume that you're being treated here and your mother gets ill and you have to go take care of your mother. Then we would stop your treatment right where we were and we would come back to you when it was convenient for you. Or if a money situation arose and you needed to stop treatment, that's fine, not a problem at all. We know life happens and we're here to take care of those kind of situations for you. Okay, let's talk about comprehensive care. That's what we provide here. If you have one particular tooth that you want to get fixed and you come in here and say, I just want you to fix one little thing and then I'm done with you, that is not what we do here. And you probably would not be happy with our treatment here, and you probably should not be a patient here. Comprehensive care means we're going to do we're going to fix everything in your mouth that needs to be fixed. We will start with a diagnosis. You will go on your first visit, when you return, you'll go to oral diagnosis on the 2nd floor, ground floor. The student will x-ray you, thoroughly examine you with a professor there, and then he will sit down and formulate a treatment plan. Then you'll come back in and you'll come to the 4th floor where the group leaders are, and the student will present you with models and x-rays and a lot of time spent on a treatment plan, and then the group leader and the student will formulate a treatment plan. Then you'll look at it, we'll explain it all to you, we'll show you what it will cost, and you'll sign it. Now when you sign it, that doesn't mean you're going to agree to it. It just means that, yes, I understand what you're telling me. Then we start the treatment. So you're 2 visits away from starting treatment, but that's how we do it here. We're very comprehensive. Now, the first thing we do is we will establish the supporting structures of your teeth. We will deem them healthy or not healthy. What does that mean exactly? The word periodontal means around the tooth. So we will look at your periodontium, that's your gums and your bone that support your teeth. Just like a car has tires, if you've got a flat tire on your car, you're not going anywhere. If you've got poor supporting structures on a tooth, it would be foolish to hang a crown or a partial or a bridge on that tooth. It's not going to work. So first, we're going to stabilize the gums and the bone. That's called periodontal treatment. And it involves sometimes a deep scaling. It's not terribly invasive, it's not painful, but sometimes we have to do these deep cleanings to get your teeth solid. Then we will look at your teeth, we will extract any bad teeth that you have, then we will start restoring your teeth with fillings, crowns, bridges, that sort of thing, and we'll get everything done. We call that operative dentistry. Then the next step is we will replace your missing teeth if you have missing teeth, and many of us do have missing teeth. So those are the steps in comprehensive care. Then we've got you fixed, totally. We want to keep you fixed. How do we keep you fixed? We send you upstairs every 6 months. We want you to come back every 6 months and get a cleaning. Now you can choose to go out into the dental world here in Memphis and do that outside of here. We want you to stay with us, but if you want to go back to a dentist out in private practice, that's fine too. So either way you want to do it. So comprehensive care, what that does, that rids your mouth of disease, we restore you, and then we keep you that way. That's our goal here. Last week we were working here in the clinic, and one of my senior students, he was delivering an upper and lower full denture. And we do incredible dentures here. And this young lady had been without teeth for a long, long time. She wouldn't smile. Every time she would try to talk, she'd cover her mouth with her hand. And we delivered the denture, And we handed her a mirror, and she looked, and she started crying, absolutely tears of joy. And she got up and she hugged my student, and then she hugged me, and she promised me an apple pie. Those type relationships are just incredibly rewarding for the patient and the student, and that's how we're going to treat you here. You may not all hug us, but you'll appreciate what we do.
Patients seen in the undergraduate and graduate clinics are responsible for payment of services rendered at the time of the appointment. Payment can be made via check, cash, money order, Visa, MasterCard, Discover, and/or Enhance. Enhance Patient Financing is an outside company that one may apply for a credit line by contacting them at www.enhancepatientfinance.com. Once you have completed orientation, you will be assigned to a student where the student will set up an appointment. You will come in, pay for the services. The treatment will be completed. Upon completion of the treatment, you will be able to come to the billing office where we can print off a claim for you to submit to your insurance company for potential reimbursement. For more information about payment options and the billing process, please visit our website.